Arthritis, what it is, symptoms, causes, and more. Arthritis is an inflammation of the joints. There are more than trusted source 100 different types of arthritis, with different causes and treatment methods. Rheumatoid arthritis, RA. Psoriatic arthritis, PSA. Gout. The symptoms of arthritis usually develop over time, but they may also appear suddenly. Osteoarthritis. The typical age for developing rheumatoid arthritis, RA, is between ages 30 and 50. Osteoarthritis, OA, commonly develops after the age 50 or 60 years, but there are studies that reveal radiographic evidence of OA occurring in women in their 40s. Joint pain, stiffness, and swelling are the most common symptoms trusted source of arthritis. Your symptoms may also feel worse in the morning when you get out of bed or upon standing up after you've been resting. Other symptoms of osteoarthritis include limited range of motion that sometimes goes away after movement, clicking or popping with bending, muscle weakness around the joint, instability or buckling of the joint, bony growths in the fingers, grating or scraping feeling in the knees. Other symptoms of rheumatoid arthritis include morning stiffness that can last 30 minutes or more than one affected joint, onset in smaller joints like feet and hands, same joints on both sides of the body are affected, fatigue, low-grade fever, inflammation of the eyes and mouth, inflammation of the heart muscle and blood vessels, low red blood cell count. Arthritis may be caused by trusted source. Wear and tear of a joint from overuse. Age, OA is most common in adults over age 50. Injuries, obesity, autoimmune disorders, genes or family history, muscle weakness, osteoarthritis. Normal wear and tear causes OA, one of the most common forms of arthritis. An infection or injury to the joints can exacerbate this natural breakdown of cartilage tissue. Cartilage is a firm but flexible connective tissue in your joints. It protects the joints by absorbing the pressure and shock created when you move and put stress on them. A reduction in the normal amount of this cartilage tissue causes some forms of arthritis. Rheumatoid arthritis. Another common form of arthritis, RA, is an autoimmune disorder. It occurs when your body's immune system attacks the tissues of the body, resulting in inflammation to joints as well as other body organs. In the joints, this inflammatory response affects the synovium, a soft tissue in your joints that produces a fluid that nourishes the cartilage and lubricates the joints, eventually destroying both bone and cartilage inside the joint. The exact cause of the immune system's attacks is unknown. But scientists have discovered genetic markers that increase your risk of developing RA fivefold. If you're experiencing severe symptoms, you may choose to schedule an appointment with a rheumatologist first. Documenting inflammation levels in your blood and aspirating and analyzing joint fluids, if present, can help your doctor determine what kind of arthritis you have. Blood tests that check for specific types of antibodies like anti-cyclic citrullinated peptide, CCP, rheumatoid factor, RF, and antinuclear antibody, ANA, are also common diagnostic tests. Doctors commonly use imaging scans such as X-ray, MRI, and CT scans to produce an image of your bones and cartilage. The main goal of treatment is to reduce the amount of pain you're experiencing and prevent additional damage to the joints. In general, treatment for arthritis involves trusted source, a combination of medications and supplements, physical therapy, occupational therapy, nutrient-rich diet, regular exercise, weight loss, if needed, heat and cold compresses, mobility assistance devices, such as canes or walkers. Medications. Analgesics, such as hydrocodone, Vicodin, or acetaminophen, Tylenol, are effective for pain management, but do not help decrease inflammation. Nonsteroidal anti-inflammatory drugs, NSAIDs, such as ibuprofen, Advil, and salicylates, help manage pain and inflammation. Salicylates can thin the blood, so they should not be used with additional blood-thinning medications. Menthol or capsaicin creams. These creams block the transmission of pain signals from your joints. Steroids, like prednisone, help reduce inflammation but should be used cautiously and for brief periods of time. Immunosuppressants and biologics. Immunosuppressants and biologics are prescribed for moderate to severe inflammatory arthritis like RA. If you have RA, your doctor may recommend corticosteroids or disease-modifying anti-rheumatic drugs, MARDs, which suppress your immune system. MARDs and biologics are being prescribed earlier in the course of RA. Methotrexate is now a first-line drug for treatment. Supplements. While clinical evidence and safety data trusted source are lacking for many herbs and supplements marketed for arthritis, there are a few supplements that may be beneficial. For example, avocado and soybean unsaponifiables, ASU, may help OA symptoms. Fish oil and turmeric supplements may help reduce inflammation in RA. Surgery. Surgery to replace your joint with an artificial one may be an option. This form of surgery is most commonly performed to replace hips and knees. If your arthritis is most severe in your fingers or wrists, your doctor may perform joint fusion. In this procedure, the ends of your bones are fused, eliminating the joint and therefore eliminating the site of inflammation. Physical therapy. Physical therapy involving exercises that help strengthen the muscles around the affected joint is a core component of arthritis treatment. Outside of your appointments, your physical therapist will likely recommend a plan of care that includes daily movement along with exercises you can complete on your own at home. When left untreated, symptoms of arthritis may worsen and affect your day-to-day life. Reduced mobility. Possible weight gain. Increased risk of metabolic disorders. Inflammation in other areas of your body. Risk of falls. Decreased ability to work. The overall risk factors for arthritis trusted source include. Also, women are more likely trusted source than men to develop most forms of arthritis.